Hey guys, Dr. Derek here with Hagen Movement Institute, talking to you today about one of the easiest, but in my opinion, one of the most important concepts that allows you to perform a more comfortable and a more efficient squat. If you have difficulty getting into a deep squat without your feet or knees turning out, or if you have some tightness or discomfort limiting your depth, you may have some decreased ankle mobility. It's really a discussion of physics and biomechanics as to why this is happening, because if your ankle is limiting your squat, you simply aren't able to keep your center of gravity within your base of support that you have in the ground. The common compensation we see is leaning forward to allow for a deeper squat. This can put some unwanted strains on the back and lead to inefficient movement patterns that could result in injury down the road. When observing from the side, generally your trunk or torso should be in a similar angle to your tibia or shin bone. So when you're squatting straight down into a deep squat, your torso angle and your tibia angle should be similar or close to that. To test this, if that's a limiting factor for you, try squatting with your heels elevated and see if you're able to go deeper into the squat with less difficulty. So, for example, if you put your heels up on some dumbbells like I have here, or if on a 2x4 or a 2x6, you can kind of have your heels elevated, squat down. If you're able to do this with much more ease, much less difficulty, your tibia is more in line with your torso. This is going to provide for a deeper squat, more efficient squat. So if that's easier for you, then you can try this simple ankle mobility drill. You find some kind of a wall or perpendicular object here. I just have a foam roller here. You put your fist down against that perpendicular object, put your toes against your fist, and you're going to be driving straight towards that wall, feet angled straight towards the wall. Your knee is going to be going straight into the wall this way without your heels coming up, okay? You're going to feel some tightness possibly in your ankle or your Achilles tendon back here. But what you're looking for is if you're not able to get your knee towards the wall or to the wall without your heel coming up, then you might have some limited ankle mobility. And you can just use this as a gauge and also treatment to try to improve ankle mobility. Eventually you can try to go a little bit to each side to get every angle of that ankle joint to try to loosen that up. But you're trying to go in towards the wall, you're trying to hold for a few seconds, come back out of it, try to go back and forth, really try to increase that ankle dorsiflexion range of motion in our ankle that will allow us to go for more deeper squat. Try it out, let me know what you think, and let's get moving.